let's say we want to create a pin guide. And again, pins, great for soft tissue, but we're going to try to avoid them for tooth-borne guides. You would plan it something like this. You'd bring in the iTero case. Blue Sky has pins. These are the pins. They look like this, and they're digitally planned. And you go put them on your model just like you would place an implant, but you're placing a pin. And then you just create a guide that has the outline up above the pins and just click Create Guide, and it's going to make a pin guide. So this guide would literally just snap on this patient's teeth, and it would have 3 holes, and then you're going to get the matching drills and the matching tubes. You do have to do sleeves for this because you're taking a drill, a cutting drill. You don't want to be cutting through plastic, so you do have to use sleeves, and they're tiny little tubes, like they're little sleeves because the drill is small. It's like a 2 millimeter, 1.8 or something, and you're going to drill through the sleeve to depth, and then you're going to take a pin and you're going to press it in. And then it kind of looks like something like this. And if you wanted the pins to become the reference for the rest of that case, now you can take the pins out, and then those same pins are also a part of your surgical guide, yada yada, and pins out, take this off, hold the teeth, take your next guide or your bone reduction guide, pin it in. And the pins become the reference point. But again, like we talked about, we're going to try to avoid the complexity of pins when possible. And then so you would go through, you'd create a bone reduction guide where those 3 pins or 4 pins become the reference. So then you flap the case, flap it back, take your bone reduction guide, and you pin on that bone reduction guide, and now you have something that you can just lay your burr on and just go straight across and reduce the bone. I'm not going to spend too much time here on the how because we're not going to want to waste our time doing bone reduction guides today. But this is going to be in the presentation if you want to go back and reference it. You've got your STL. You can go create an undercut model of that so it's got a path of draw on it. And then you're just going to create a guide on your bone STL, and that guide can then be cut at the level you want it. So like, let's say you have a jaw that you have an STL, just build a guide over it, and then use your Blue Sky cut functions, that lasso that you can cut away stuff. And you're just going to look at it from the facial, and you're going to just cut that guide where you want to do your bone reduction. And remember, you want to do your bone reduction like a millimeter above your implants if you want to be 1 millimeter subcrestal. So you could turn on all that stuff transparent, so you can actually look through the guide, through your STL of your jaw, and you can see your implants in there, and you could turn the screen, sideways, and then just use your cut all function, and you're cutting that guide. So that's what I did here. I cut the guide and the bone, and now what you're left with is a bone reduction guide that you can snap on the jaw. So that's kind of like a 10,000-foot view of how you would do that. We're not going to do that, but now you guys get the idea of like how that's done. Just create a guide with pins on the jaw, and then cut all at the level that you want to. So we already talked about, why do we reduce bone? We need space for the FP3. So we want 15, maybe 12 to 15, and we want to hide the transition lines, and we want to create a nice flat bone platform.
If you're placing these, if you're doing a tooth reduction guide where you're selectively extracting teeth, putting on the guide, placing your implants, 4 or 5 millimeters subcrestal because you're planning on reducing some bone.
Yep.
How do you have drills long enough to do it? If you're placing 11.5 or 13 millimeter implant,
it's a great question.
You're going to be bottoming out your drills way before you're at the depth where you need them to be to place those implants that big.
Yeah, that's a great question. So how I do that is actually you do a little bit of bone reduction before you put your guide on. So what I'm going to show you is...
The guide still rests on the teeth.
The guide rests on the teeth. So you're going to do some bone reduction between the teeth.
But how does that... Your drills are still going to bottom out on your sleeve, on your guide, right? Are your drills long enough to be able to place the implants to the depth?
So what we're going to do, and this is what we're going to go through, is we're going to selectively extract those teeth. And you're going to see that guide tube is deep, right? Because remember how it's buried under the model?
Oh, yeah, now I get it.
And now you're going to edit the model to drop it below so that when you print your guide, it's fully incorporated. But now if you take that to the mouth, it's not going to seat right, potentially, because it's hitting some bone.
Yeah.
So on those cases, you're going to selectively extract the teeth, and then you're going to do a little bit of bone reduction to get close, so that you can get that guide on, and it'll snap on, and it'll go down and not hit bone. And you might say, I can tell I'm hung up a little bit over here. Take it off, take down some bone, until all of a sudden it snaps on. And now you know that, hey, I can just drill to depth because your guide tubes are where they need to be. Does that kind of make sense?
Yeah, it does.
Yeah. So it's digitally altering the model, and then surgically doing some light bone reduction beforehand. And really where you'd want to end up is like somewhere between that guide tube and between the implants, so that the guide seats, you can place your implants, and then you could go back and still feather it a little more down. The alternative is you can continue to increase your offset, right? Like we talked about before, you could bring your guide tubes up higher, but then you run into longer drills, and you got to do the math, and then the wag factor. So the closer we can keep the drills to the implants, like that 8.5, the better. And so far it's worked out pretty well to do that. I haven't, you just kind of eyeball like, okay, I need to take down some bone to get this guide to seat on, and not too bad. So again, kind of an older case, but now you can see I've got enough room for teeth. That was the digital wax up that was already done prior. Now you can see my bone. I've got enough room for teeth to build what I need to build. And then this is kind of a crazy surgical guide with a bunch of tubes, kind of an older way that I used to do it. Not really preferred as much anymore. We can, when we're building the surgical guides, this was pin supported. So this was all in 4, 1, 2, 3, 4, with a palatal rest, and then 3 pins there. That's it in the mouth. It looks kind of like a spider web, but you can see kind of the complexity. Again, early on case, we've simplified this a lot more, but you can see kind of the fun stuff that you can build. And that's kind of all custom built, those tubes in Mesh Mixer and stuff. We're going to try to just keep things simple in Blue Sky. So here's a picture of a whole stack of guides. This is when I was doing those multi-guides where it's like, you got your tooth pin guide, then you got your pinned bone reduction guide, then you got your pinned surgical guide, kind of all the guides being printed at one time. Super, super crazy cases. And again, before selective tooth extraction preference. And this is, this is the 95, so you can fit a lot more. That's the big build plate on the 95. So good if you're printing a ton of stuff.